On the road, in the gym, at a coffee house. No matter where you listen, this is Prevention Perk. I'm Steve Miller with Mid-America PTTC. It's time to perk up our prevention efforts. My guest today is the Director and Chief Research Scientist at the Montana Institute, Dr. Jeff Linkenbach, who has developed national award-winning programs that change community norms. He created the National Conference on the Social Norms Approach to Prevention, which has since transformed into the renowned Montana Summer Institute on Positive Community Norms. Jeff's work is all about translating social norm science into practical applications and provides training and technical assistance for others to help them implement effective norms interventions in the communities they serve. Hello, Jeff, and welcome to Prevention Perk.
Hey, Steve, thanks. So great to be here.
Yeah, it's good to have this conversation with you. Let's just jump right in. My first question always is, how in the world did you get interested in doing prevention work? What led you down this path?
Yeah, Steve, thanks. I guess what got me interested in prevention work was that I came through, like many people, I came through the door of doing therapy and substance abuse treatment, recovery work. And I started, as part of our outreach, working in inpatient substance abuse treatment, we go out into the schools and we take this message of, honestly, it was a fear-based message, which we no longer do, right? But taking out these messages out into the schools and saying, don't do this, you're at risk for that. If you do this, you're going to end up here. All of you are doomed, right? In essence. And I actually remember the day. One day I was speaking to a room of high school kiddos, and one of these students stood up and said, "Dude, that's not who we are." Meaning this dark, dim, skewed view that I had of them. And that started me on a new path of going, okay, if that's not who you are, who are you? And then how can I best understand and serve your needs? And so it really was, that's where a seed was planted for me, was that young man. And since then, actually a couple of years ago, he resurfaced and said, "Do you remember me?" I said, I do. I do.
Well, that's got to feel pretty good.
Yeah.
Yeah. Wow. To go full circle like that. Well, so your work has really evolved from, correct me if I'm misunderstanding, but really the foundation of this is the science of the positive. Is that correct?
It is, Steve. Yeah. The science of the positive. And the science of the positive is the study of positive factors, how they impact us individually and then collectively in terms of family systems, organizations, communities, and beyond. And it's really based on this core assumption that the positive exists. It's real. It's not just some idea, theory. The positive exists, it's real, and it's something that we can grow and expand, so we can be very strategic about how to apply this in different settings, like across communities or schools.
You're listening to Prevention Perk. The funder of this project, along with all the other products of the Mid-America PTTC, is the Substance Abuse and Mental Health Services Administration. Although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Community engagement, an essential component of an effective and equitable substance use prevention system, is an evidence-based resource guide which highlights research on community engagement in substance use prevention and provides practical guidance for implementing and evaluating community engagement strategies and activities. You'll find a link in the show notes to this resource. So when you talk about the science of the positive, I'm not sure that maybe the audience has heard that as much as maybe they've heard the term positive community norms, which I think you also pioneer in your work. And I know that that's when I first was introduced to you, and I heard a presentation about positive community norms. But how do you use that as kind of a framework to address, like substance use or maybe other risky behaviors in the community? I mean, how does that give us the brief presentation on that? What does that look like?
Yeah, thanks, Steve. Yeah, so the science of the positive is the core framework. And there's some core elements with that. Again, that the positive exists and it's something that we can strategically grow and expand. And then that moves into some different frameworks like positive community norms. And so positive community norms is one of many different norms approaches. Many people have probably heard of social norms. That was something that I was involved in for many years as well. There are many different human behavior change theories that focus on norms, cultural norms, social norms. For us, we talk about positive community norms. What we do, the positive community norms approach really has a logic model that unpacks four things, be four steps or four phases. And the first is to uncover the positive, that the positive exists and that we can use science and surveys and other ways of uncovering positive protective factors that already exist in a community, for example, or in a school. Then we're also measuring step two. We're starting to measure gaps. We're starting to measure misperceptions of the positive. Oftentimes, we see the world or our community, our coworkers, our classmates in a much more negative way than who they really are. For example, we often see risks more than we see protections. And so we have these distorted norms. We have misperceptions of norms. So we can measure that. We can measure these gaps between what's really going on and what we think is going on. Then step three is we're going to construct interventions like communication campaigns to correct those misperceptions. It takes a lot of effort to overcome, years and years of misperceptions, but we see that we can do that. And then the fourth step is actually measuring the positive outcomes, measuring increases in health.
Now, you mentioned early on when you were talking about kind of your transformation into, prevention and the work that you do, you said, we don't rely on the scare tactics like in days gone by. And I don't see that as prevalent as it once was. Every once in a while, you might read through a little bit of trying to scare straight the audience, so to speak. But overall, we've advanced from that. But when you talk about framing it for positive community norms, to me, it's like, yay, this makes perfect sense. You kind of spoke to that, but can you unpack it a little bit more? Why is it so hard to sell the positive?
That's a great question. First of all, I want to underline what you said. My experience is the same, Steve, that I think we are seeing a shift away from the focus on fear, the focus on scare tactics. I mean, it's been decades in coming, and some major organizations are really starting to see that just that use of fear isn't just neutral, but it can backfire. In the medical profession, they talk about iatrogenic effects, like physician or caregiver caused harm. The fear tactics can do that. And so I think, first of all, I agree that there's been a shift away from the fear towards more positive approaches. The second part of your question, why is it sometimes not fully embraced? I think because we often oversimplify the positive or positive approaches. We oversimplify it, for example, and think, well, does this mean we just have to do happy things, Pollyannish, fuzzy, furry unicorns with rainbows? and the answer is yes, I love all those. However, growing the positive is much more strategic and much more challenging than that. But I think we underestimate what's really involved. And that's sometimes why we will hear people say, well, that's not going to work around here. My people won't go for that. I think they're thinking more of just trying to change, positive mental attitude or something oversimplified. And that's not the case.
Well, what's interesting when you say it like that, I sometimes wonder when it comes to that positive framework, and you alluded to the young man that kind of got your attention early on. Do you think that this resonates more when you're talking to, let's say, teenagers or adolescents, like putting more of that positive, I don't want to put a spin on it, but that positive outcome on it, because they still are very magical at that age. I think when we get older, we're the adults with this, fully formed prefrontal cortex and the brain is operating at optimum, hopefully. We tend to see it differently. And I would think that looking through a lens that's more, positive, or community norms that are positive, that it would hit harder with adolescents. Yes or no?
Yes and no. I think we all are hungry for it's something at our core to have experiences that are positive, where we belong, and positive experiences can be transformational. One of the applications of our work and research has been around what we call HOPE, which it's an acronym for healthy outcomes from positive experiences. And while much of the HOPE research has focused on young children, it extends across the lifespan. Now, with your question about adolescence, I say the yes part of that, because it's absolutely a time in life when we are hungry for positive experiences. We're seeking those out. And if you think about being in a room full of 16-year-olds, there is energy in that room, right? There's going to be energy.
Oh, yeah.
And if we can ask the right questions, that can elicit some positive kinds of reflections, and young people are very hungry for engaging in positive experiences where they have a sense of connection and meaning and belonging. And so, yes, like to underline your question with an experience I've had, we often hear young people say, well, it's about time adults see the good stuff we're doing, right? It's about time our community sees that we're not all just out there engaging in, drug, alcohol use or risky behaviors. It's nice that we're being recognized, that most of us are making great choices. And so we hear that quite often. And I think that really underlines, kind of the question that you had.
I think that's been my experience. I've been doing prevention work now about 14 years. And just, if I listen to some of the presentations that I've heard in that time frame, like going through my mind, I can see where there's been this evolution of the younger voice being inclusive. I mean,
Yeah.
I've seen where middle school students, high school students are actually really being valued for their engagement at the coalition table, and recognizing that this is a community issue. It's not an us or them or something like that. And I can see why they would think that they're being valued, because they do want to see life through, rose-colored glasses, so to speak. That's their time in life. They should. How do we include that conversation, along with the seriousness of prevention? That needs to be the focal point, but at the same time, I could see the positive needing to be at the forefront.
Yeah, you really bring up an important strategic platform that we operate from, with the science of the positive, with positive community norms. And that is this integration of both hope and concern. Integrating both hope and concern. And we find that it's really important that we do both of these, that we speak to both of these. What I mean is, if we only come out only talking about the hope, the positivity, the possibilities, somebody in the room will, I think, rightfully say, yeah, but that's not the full reality. There are also these concerns that exist in our community. And that is absolutely the case. And so what we find is if we just speak to one side of that balance, we will be imbalanced, right? If we only speak to the concerns, only speak to the risk factors, that's not painting a true portrait of who we are as a community. And if we only speak to the positivity and the aspirations, that's missing some things too, in terms of some people that are really hurting. And so constantly learning how to weave the hope and concern into conversations, into communications, into intervention and prevention strategies, it's what we find works best. And young people get this. This is something we can do. We will teach a room full of young people how to take this out as leaders, how they can do it. They get it. They can grasp it, like you said, at a coalition meeting or other venue.
Well, I'm kind of curious from the audience's perspective, if we're listening in, I'm wondering, so this message, is it when you deliver it in a community or a coalition or a conference or something like that, is it a universal message, or that when you really get to work in a community, is it more tailored for what you expect their needs to be for that community? Because you made the comment earlier, someone might say, well, that won't work here. Are you saying that universally that could be a comment, or they're looking at their community being different? And do you go to that effort in providing training or technical assistance to really try to deliver it in a way that will be receptive for the community in a positive fashion?
Yeah, great question. Obviously, the latter, as to what you've said, that when we're working with a community, we have to work with the unique elements, ethos, culture, history, context of that community. And at the same time, there are some universal principles and strategies that work everywhere. An example being that we find that the misperceptions of positive norms exist everywhere. We've seen that across, Missouri, your home state, with issues of substance abuse, substance use, with young people. We've seen it with child maltreatment issues, working with the Missouri Children's Trust Fund, for example, and some of their leadership and their surveys, where adults are misperceiving the behaviors, the positive parenting behaviors of other adults. So we will see this in a universal way, as a kind of a macro pattern. And yet we have to come down into the more local levels to be most effective. So what does that mean? It means if we can have accurate norms data for an individual school, that's going to work better for developing a campaign, for example, than just talking about statewide data and trying to reach those students. The misperceptions will exist at both levels, but the local data speaks differently to people.
Yeah, that's fascinating. I think your work is spot on, and I've been thinking about it a lot recently. I was at the Kansas Prevention Conference, and I heard a presentation that the hope presentation is essentially what it was, and I thought I want to figure out what I can do to angle more in this direction more intentionally, not just every now and again reminded of it, but be more intentional, because I think that's where you really build it out. Is you have to have that intentionality for something to really, take root. And so that was just for me. I really just like, yeah, that really resonates with me. So yeah, I'm glad
we
we're having
hear
this
that a lot,
conversation.
Steve.
Yeah.
I mean, what you just said is, I think, really important. There's kind of a gut check, if you would, where it's like, you know what, that just makes sense. You know what? That resonates for me. I like that better than the alternative, right? I mean, if it's unpacked well in how we're explaining this work, how people are experiencing the work, having some direct experience with the work, there should be that kind of a validation as to what you just said. This makes sense, right? This makes sense to me that if we want health, we need to promote health. I know that sounds oversimplified. If we want health, we need to promote.
It sounds almost too simple, but it is true.
A lot of times, if you think about some of our logic models that we develop, we'll develop these complex logic models in prevention that will say things like, if we want health, we need to raise awareness of all the unhealth and then strategically design strategies so that people don't want to do that. Well, there's merit to some of that, but that's a model that says if we want health, we need to tell people all about the unhealth so they won't want to do that. That doesn't seem to work as well as if we really want health, we're going to need to promote, model, grow, measure, talk about, and create narratives of health. So it becomes very strategic about how we do this.
Wow, that's interesting. I see where you're coming from, and that's what I thought of when I was going through this experience just recently. It's like, I know this. I heard you speak about positive community norms. It had to have been 6 or 7 years ago here in the state of Missouri for their prevention conference. And it's like every once in a while that comes up in a conversation, but I never really thought be very intentional about that, because that's where, for me, my personal strength would come from. And if I'm more rooted in it, then that helps to translate it to the people that I interact with. You know, you're not going to absorb it if it's just kind of an afterthought. It's got to be a part of, the regular, so to speak.
Yeah.
I am interested if we can talk a little bit about, so you lead the Montana Institute and you have the Summer Institute, which I would just love to be able to attend. Maybe that'll be in my calendar this year, but is this the kind of, do you focus primarily on this during those trainings, during that conference? Is that what you talk about? And I know you also do other things like transformational leadership experiences. And for me, it sounds like this is what you've baked into practically everything that you do. Is that where your approach is coming from?
Yeah. The Montana Institute, people could look up the website. Yeah, just typing in the.
I'll put a link in the show notes, so I'll have that as well. But yeah.
So we'll provide trainings at as everyone does right now, both virtually and on site, across North America, for different groups, coalitions, communities, organizations, right? And we operate different projects that focus on positive community norms, some at like state level. For example, a flagship project we have is with the state of Minnesota, the incredible work that the Minnesota Department of Human Services has done over the past couple decades. We're in our 4th and 5th 5-year cohort with that group. We will work with 10 communities at a time as a cohort for 5 years. And we're in our 4th and 5th cohort with them. And we've got some, that group has had some tremendous positive results in terms of reducing youth substance use. So we'll do some of these larger scale projects along those lines, also with colleges, universities, and other organizations. And then we provide different trainings as well. Big focus on transformational leadership. The science of the positive is a transformational leadership approach. And so we'll be focusing there. And then we do the work around hope, health outcomes from positive experiences, where we're doing a lot with leaders around early childhood development. This evolved out of some of our work with the Centers for Disease Control and Prevention that we've done. Our flagship, our kind of our marquee event each year is our Montana Summer Institute. This year it'll be in July. You can get information on the website about that. And we'll have about 350 people. We have to cap it at 350. We do it at Big Sky, Montana, and that's our our capacity with the resort. And we will talk about these and other cutting edge topics, some of the things that we or some of our partners are really unfolding.
You're listening to Prevention Perk. If you'd like to take a dive into the science of the positive and positive community norms and learn how you might apply these practices in your prevention efforts, we encourage you to visit montanainstitute.com/publications. I'm curious, before we get away from one another, is there something that we haven't talked about that you want to make sure you impart to the audience? I always think of it as you're the sage on the stage. Is there something you want us to think, say, or do now that we've had this conversation?
That's such a great question. Let me just think for a moment. I think what I like to leave with people are questions rather than answers. That's, as someone that's studying and been studying transformational leadership for most of my career, I find it's the questions that we ask and think about with each other that matter. So I think one of those questions, for example, is, are we getting the results that we want? And how do we know, right? Are we getting the results that we want? And how do we know? And so that could be results that we want externally with the programs that we're focusing on with others, but also for us internally. Are we getting results where we feel more excited to show up and do the work each day? Like, do we have a measured increase in a sense of aliveness and joy, right? That's a metric we may not think about. Another example is a question like, are we busy or are we effective? Right?
That's a powerful question, right?
It's a powerful question. And I think every one of us could say, well, we've got some of both, right? Even on our best day, we've got busy stuff that may not be really translating into, are we being most effective? And is that effectiveness aligned with our purpose, our calling, our why? These are some of the kinds of transformational leadership questions that I'd like to leave people thinking about, because this is what, when I wake up in the morning, I get excited about in terms of this type of a dialogue with fellow leaders and where we can take that. Because I think we're all called to serve in a way of being a part of a bigger story. And I'm intrigued with, what is that bigger story? If we all come together for a collective impact, how can we make the world a better place?
When you said, are we getting the results that we want? And my first thought was, when you visit the strategic prevention framework model, we talk about not just evaluation being something that is done at the end. It's something that we should be doing through the process.
Sure.
But I always think that if it's the kind of results you were looking for, that leads your sustainability, because you're excited to continue doing the work. And I don't know how often we really are. Again, this goes back to a word I just used. We're intentional about what are the results we desire, and are we achieving those? Because am I excited to keep doing this work?
I think we think about sustainability in too narrow of a manner. And I hear you saying that too. We think of it in terms of, okay, what's the next funding source that might kick in to pick up these aspects of a comprehensive approach? But, at the end of the day, if we're burned out, if and not feeling sustained by the work, we're not going to be able to sustain it. I really like how you shifted that, Steve, and you brought it to an internal focus as well. It's not just external. There has to be a way that we as prevention leaders are experiencing a sense of rejuvenation, and that's sustainability.
Yeah. Well, Jeff, this has been a positive conversation to have today. Thanks for bringing that to our platform. I appreciate you being a guest today on the Prevention Perk.
Steve, thank you. It's an honor, and thanks to all your listeners. I really appreciate the voice that you're bringing to the prevention world. Thank you.
And thank you for listening to Prevention Perk, a podcast from Mid-America PTTC. To learn more about our innovations, visit pttcnetwork.org and look under Your PTTC for the Mid-America link. Remember, prevention is better together, and together we are stronger.